the JAMA Network.
It's clear those serving in the U.S. military face unique stresses, including deployments to Iraq and Afghanistan.
And some people have thought that these deployments may have been increasing the risk of suicide.
Cynthia Lurdman from the Naval Health Research Center and co-authors compiled and linked data from the National Death Registries and the Millennium Cohort Study, which looks at the long-term health effects of deployment on service members. Director of the study team, who worked closely with the study authors, is Dr. Nancy Crum-Cianfloni.
In the last year, there's been approximately 1 death per day on average due to suicide among our active duty force.
Researchers examined 22 risk factors, including number and length of deployments, combat experience, rank, and mental health disorders like manic depressive disorders, depression, and alcohol misuse.
There was actually no relationship between deployments in support of the current operations in Iraq and Afghanistan and the subsequent occurrence of suicide.
The study appears in JAMA, Journal of the American Medical Association.
What we did find is that the mental health factors were associated with suicide, and these included depression, manic depressive disorder, and alcohol-related problems.
Male service members had a 2 times higher risk of suicide than female service members, but this same trend also exists in the general population.
The majority of suicides actually happened among non-deployers, people who actually never deployed in support of the current operations.
Screening and providing adequate and effective treatment for mental health disorders is probably the most important thing that can be done for these service members to help mitigate the risk of suicide.
Catherine Dolf, the JAMA Report.